The United States is the largest single donor of Global Fund, dispersing around $72 billion in the 2023 financial year. And Botswana has been the major recipient of that aid, receiving around 600 million pula in recent funding. The funding freeze has now forced multiple civil society organizations to shut down operations, affecting organizations such as 𝒔𝒑𝒊𝒂𝒍, 𝒔𝒑𝒊𝒂𝒍 Wellness Center, Botswana Gender-Based Violence Prevention and Support Center, and 𝒔𝒑𝒂𝒏𝒆. Over 85 service centers across the country, from the capital Gaborone to remote regions such as 𝒔𝒑𝒊𝒂𝒏𝒆 and 𝒔𝒑𝒂𝒂𝒏𝒆, have stopped operations. 𝒔𝒑𝒂𝒏𝒆 is Bonela's executive director and the chairperson of the umbrella NGOs, the Botswana Council of NGOs.
We are talking about a very dire situation. We have not recorded closures or organizations closing down, but what we have recorded greatly is the scale down in programs because of the withdrawal. Most civil society organizations had support from various donors, even those that are not directly related to the US. So that is what has sustained civil society organizations. If I were to use Bonela as an example, an organization that I lead, we had a staff complement of 86 before the withdrawal of funding. As I speak to you, we have 16. So it means all the people that were affected are in the streets without employment. We had 11 offices across Botswana. We had to close all of them down except the headquarters one, which is based in 𝒔𝒑𝒊𝒂𝒂𝒏𝒆. So that is the extent of the impact.
According to a rapid assessment conducted by Congo, at least 680 employees from various CSOs have lost their jobs, with the number expected to rise as the situation unfolds. One of the affected frontline workers, 𝒂𝒚 says she is struggling to make ends meet.
Ke amegile thata ke tsoga ka maikutlo a tlhakatlhakaneng nako tsotlhe ga ke tshele botshelo jone ke botshela ga ke tshele sentle ga ke kgone go tlhokomela ko lapeng ga ke itlhokomele ke rentisitse ntlo ya batho e batla madi ke na le dikgwedi tse 6 gompieko ye ga e wela ke a bo 7 ke sa duele rente ba nna ba ke ntse ke ba rakere gongwe go tla siama ba sa mphelele pelo ya no mo kgweding ene e fetae ba ne ba nkokotela mongwe a lelwapa a re o batla madi a gago go simologa gone ko ne ke simola ke kolota teng up to now.
The withdrawal is threatening to reverse Botswana's progress towards the UNA's 95-95-95 goals, a milestone achieved in under 2 decades. The strategy aims to ensure that 95% of people living with HIV know their status. 95% of those diagnosed receive sustained ART, and 95% of those on treatment achieve viral suppression. 𝒔𝒂𝒏𝒆 also shared her fears that this particular decision may potentially take Botswana back in the fight against HIV.
Our clients ga di emella dia go batla di thuso like o motho o na le HIV virus ga o tsena ko tleliniking o re wa go tsa madi ga dilo tsotlhe tse di tsa madi ga diwo plus gape ga o tloetse gore o no nna o fiwa dipakete tse di pidise gongwe di le 3 or 6 o no neelwa e le 1 mo ile gore e ne le dilo tse di sa tloelesegang o boela kgapetsa ko tleliniking mme gape re na le letshogo le lentsi ka gore nako sa tseiwe madi ka gore ne re itse gore gate tsone dipilisi tsa rona di na le di side effects re itse gore go na le go swaga sebete bo diphilo ne re nna ka letshogo ene batho ka bontsi ba amegile tota mo go yone kganyone eo ya go sa tsewa madi.
Founder and director of Success Capital, 𝒔𝒑𝒊𝒂𝒍, says the decision will affect the collection of critical data for policy making in the country.
We were primarily working with LGBTIQ youth and also acknowledging, LGBTI are quite diverse. There are those who are engaged in sex work, and so that meant demand creation services, linking to the broader public health system or with other institutions such as 𝒑𝒊𝒂𝒍𝒆 is essentially halted. Another critical component is the ability to collect data. So collecting data in terms of new HIV incidents, collecting data in terms of access to contraceptives or condoms in public health facilities. So essentially the kinds of community data that provides insight to policy making. And so in just looking at even the broader global health context, health security has been compromised because different CDC organs essentially have been stopped. Online databases that provided demographic information have been stopped. Vaccine information has been stopped. So I think it's just recognizing that in as much as it has impacted the global health architecture, it has also impacted grassroots lived experiences.
Approximately 66,000 vulnerable individuals have been affected by the loss of services, including those receiving HIV/AIDS treatment, gender-based violence care, and life skills training. Responding to the crisis recently, the government made an undertaking that those who had been receiving health services at various NGO centers will be enrolled at public health facilities. In August this year, the government said it has since come up with alternative measures to continue providing care for clientele following the decision by the US government.
Our ministry has since come up with alternative measures to continue providing services to clients that previously depended on these services. These clients are currently being offered healthcare services in government facilities within their proximity. Additionally, health reprogramming is ongoing to ensure that community health services are prioritized through upskilling of community healthcare workers. The ministry will continue to look into more alternatives to ensure that its mandate of healthcare delivery is extended throughout the nation.
While civil society groups have appealed to the government and other partners to fill the gap left by the United States, 𝒂𝒂𝒚 says the organizations are now competing with other NGOs in other countries for the little resources made available by international development partners.
What has happened, regrettably, is that because of the geopolitics around the world, we have seen even other donors, apart from the US, cutting down on funding as well. As you may know, our programs are competing with other global challenges that are currently happening. We have the Ukraine war, we have the Israel saga as well. We have migration, which is a huge problem in Europe. There are so many competing priorities. So you can see that our European support has shifted to other priority areas.
When you look at any, if I can say, higher middle income countries such as South Africa, they're able to benefit from resources because there's a legislative provision that provides for corporate social responsibility. And so essentially you're saving yourself from paying additional tax as a result of being able to invest in corporate social responsibility. If you look at high income countries, so wealthy countries, they're funded by municipalities and town councils. LGBT shelters are funded by the mayor's office in Washington, D.C. as an example. And so I think for me, it's recognizing that essentially when we're talking about domestic resource mobilization, because that's where the conversation is going, we're not acknowledging the fact that our own governments don't have the political will to fund LGBTI people, they don't have the political will to fund sex work, they don't have the political will to fund harm reduction. Harm reduction doesn't necessarily mean taking someone out of substance abuse, but it means providing, for example, needles, clean needles, so that they don't transfer any infections to each other.
A former sociology lecturer at the University of Botswana, Professor 𝒂𝒂💚 says although the suspension is a devastating blow to many countries, perhaps the time is now for African governments to look into their own resources and reduce reliance on foreign aid.
It is time, because those guys have been sitting on our necks, but control with sweet little nothings. So if we have an American government that doesn't recognize they actually were controlling us by giving us peanuts, then that's good for us. It's time we looked inside. But look, even our new government, where does it run? All over the place, but not within, our new government should have been to what businesses can we do with the land? But particularly, can we manufacture things on the African continent? What do we need?
During its election campaign last year, the ruling UDC had promised to allocate at least 1% of the national budget to the civil society movement to help civil society organizations sustain their operations independently of foreign aid. 𝒂𝒚 𝑻𝒔𝒊𝒚 𝑵𝒌𝒆𝒍𝒆 News, Gaborone.